we go.
Good evening, ladies and gentlemen, and welcome to this program presented by the Union League Club of Chicago and its Public Affairs Committee and the Subcommittee on Health and Life Sciences. I'm Dave Cohn. I'm Executive Director of Public Affairs at the Union League Club, and on behalf of the officers, members, and directors, it's my pleasure to welcome you to this evening's webinar that we're presenting as part of our ongoing effort to keep everyone informed about best strategies to get through and to come out well on the other side of the coronavirus crisis. Tonight, the Health and Life Sciences Subcommittee has arranged to have a presentation by a member of our club and someone with extraordinary expertise in an important aspect of dealing with a disaster, a crisis such as the COVID-19 pandemic. Geary Sikich of Logical Management Systems has forgotten more about how to prepare for and to survive natural disasters and other disasters than most of us will ever know. I've known and had the pleasure of working with Geary on previous occasions. For those of you who recall living through the H1N1 flu episode, we had a series of programs also presented by the Health and Life Sciences Subcommittee of the club about strategies to prepare for and to protect yourself and your employees during the H1N1 flu crisis. And so Geary is someone who understands this extraordinarily well. He consults and works with companies all over the world on a regular basis. We mentioned in the promotion of the event that he has a book entitled Protecting Your Business in a Pandemic, Plans, Tools, and Advice for Maintaining Business Continuity. So we couldn't have a more expert speaker. And Geary, we thank you for joining us. To get us underway, I'd like to turn it over to the chairman of our Health and Life Sciences Subcommittee for some introductory remarks, Marco Martino. Marco, it's all yours.
Thank you. Thank you, Dave, for the introduction, and thank you, Geary, for being able to join us tonight. My name is Marco Martino. As Dave stated, I am the Health and Life Sciences Subcommittee Chair for this year. And, with everything going on right now, we're just trying everything we can to utilize our virtual platform to, as Dave stated, to inform everyone about what's going on with COVID-19. About a couple weeks ago, if you were able to join us, we had Dr. McWynn. She talked to us from the front lines from Rush Hospital, which was great. And I just want to keep that theme going, keeping people as informed as possible. A lot of things are unprecedented right now, unfortunately for some people. This is the second time we're going through some kind of a recession, and I think these scars are really starting to turn to scabs again and being ripped off. So I'm just looking forward to this opportunity to having Geary talk to us about an economic point of view about COVID-19 and disasters in general. So again, thank you, Dave, for the introduction. Thank you, Geary, for joining us.
Sure. And for those who are joining us online, as you well know by now with the Zoom platform, please feel free as we go forward to submit questions via the chat feature, and we'll be happy to pose those to Mr. Sikich as we proceed. Geary, let me ask you to open by giving us a quick overview of how you got into the business that you're in, and you must have been very busy as of late responding to client concerns and needs all over the world. Can you tell us a little bit about your practice and what you've learned over the years about disaster preparedness? I guess preparedness being the key word, because you can't respond unless you're prepared. So Mr. Sikich, let's turn it over to you for the presentation.
Okay, thanks, Dave. I'm going to try to go to my next slide here, and let's see. So this gives you a little brief background on me. I've been doing this for now over 30 years. Started actually when I was in the military. I was asked to design some concept testing for the Army, which became eventually the National Training Center out at Fort Irwin, California. The process kind of went this way. The Army realized the way they were training, they weren't going to be able to do things in combat like they should, which meant survivability was low. So they asked me to start some design and testing. When I left service, I got involved with a company that did some follow-on work with this process, and essentially kind of fell into a lot of crisis situations. So got involved with 3 Mile Island in the nuclear industry, went from there to the chemical industry with Bhopal, went to the oil industry with Exxon Valdez, the financial industry with the Y2K and other issues. And then as the practice developed and as I began building out, I started writing books and started to work with more companies on a broader basis. So I've worked with almost every industry sector, which has been really a pleasure for me because it's been an eye-opener to see how closely related things are that people don't see as being highly related. So I've written 450 articles that are published on the internet. The books that are out are available in a variety of places. And as it is, I basically looked at this area, and when we started to do the pandemic planning for bird flu and then swine flu, recognized very quickly that when coronavirus erupted, that the situation was beginning to present itself as very similar to what we had prepared for. Unfortunately, in the interim of years, it seems like preparation sort of went by the wayside. And I'm kind of, I'll go through some things, but I was kind of shocked by the response that we had initially to the situation. And of late, I'm still kind of shocked because I don't think people have seriously understood this in many respects. So let me go through to the next slide. And what I'm going to cover tonight is fairly simple and straightforward.
Gary, can I just interrupt to ask one question? I mean, given that this is the kind of scenario that you've worked with across many years of your career, would it be fair to say that the COVID-19 pandemic is at a greater scale, greater level than these other situations that you've dealt with, or is it basically, just sort of ramping up to meet this level of threat?
It's kind of at the stage where it's begun to ramp up and to start to get to where it's going to exceed. H5N1, the bird flu, never got to this stage. The swine flu, well, it did infect 60 million people worldwide and lasted for about a year. Never had the impact that we've seen with coronavirus. And so, yeah, this is kind of a situation as I look through and work with this that you literally kind of go back to the Spanish influenza to see the parallels. And I'll show some of those as we go through. But it is, in my estimation, a situation that's still on the ramp up. So we'll talk about these 4 areas, kind of an overview of pandemics in general. Some of the things we ought to be considered from a planning standpoint for near and long-term planning, some staffing considerations and some tiers of complexity. And then I'll kind of summarize things and look at where we are going to go and some things that we might want to begin to think about. So from a standpoint of pandemic, this is what the coronavirus looks like. The healthy cell being the blue, the little yellow speckles are the coronavirus. That's the extent of my medical knowledge, by the way, because I'm not a doctor. But in a summary of where we're at, we first got reports from China in January, and they're now saying that possibly this dates back all the way to September, and there's a lot of confusion on this whole issue. Well, it took World Health Organization until the 11th of March to declare a pandemic. So at that point, things started to change and people started to react a little bit differently. Centers for Disease Control has already said they expect this to last into 2021. So here we are on the 23rd of April. And at this point, we're like 42 days in, official pandemic days. So there's not a lot of, how would I put it, consistent information, and we're subject to a lot of changes in terms of information. Sector analysis right now, if you begin to look at business sectors, you see a lot of confusion and chaos. And if we look based on the information what we have, a best guess would say that we're beginning to start to see some of the bigger impact in many sectors. So that's kind of going to be an evolving situation. As I point out here, we reached the 180-day time frame, and I'll go through time frame because I have a specific look at what I think time frame will be. It'll be October before we had 180 days. So based on World Health and CDC, if they start till 2021, we got a ways to go. And then anything that I would project beyond October of 2020, I would have to say is kind of in the realm of fantasy and speculation. I don't know that we'll see a 500 to 800 day scenario. I hope we don't. I'm kind of thinking, based on what I'm seeing, that even if they develop a vaccine, that the pandemic itself, in terms of effect, will go way beyond this, 500 or 800 days. Because once we get back into trying to bring back an economy, we're going to have some real big challenges that we're going to be faced with. And there's a lot of touch points that people are becoming aware of. So I asked the question when I did a lot of work with Ebola for people who wanted an Ebola plan, which strain of Ebola are you planning for? Well, there were 6 strains of Ebola. The thing with coronavirus is that just today, I actually had to update this slide. It used to say 8 strains. This morning, I found out there are 30 strains of this virus. So this virus is mutating a lot. And as a result, there are a lot of issues with getting a vaccine, treating it, et cetera, et cetera. The website I cite here talks about looking at the virus. They do a lot of mutating maps. It's called Next Strain. And you can go to that website. It's really a good site for the visuals that it provides. The other site I'd recommend to everybody is one called Visual Capitalist. And I point this out because they do graphics. And it's really, really, I think, impactful for people to see a graphic of what a timeline would look like, or the math behind social distancing thing. So on the left side it says history of pandemics, and if you go to Visual Capitalist, you can find this particular graphic along with a really good write-up. I'll point out some things about this graphic as we go through, but look at the extent, and obviously you can't see it on the screen, but they take pandemics all the way back into the earliest known pandemics, and they began to look at the time frames with a lot of these, and of course, how many people died, et cetera, et cetera. The other side, the right side, shows the social distancing aspect, and it showed, basically what they were saying with coronavirus was that one person can infect roughly 4 people. So as the graphic shows, you can see the progression, 406 infected people fairly quickly. So spread of this virus is a real issue.
Right, and Gary, I was going to say, and one of the things that's important to note about this is that unlike other viruses in this family, there's widespread opportunity for asymptomatic transmission. People walking around, you may have it, I have it, who knows, we may be carriers, have no idea, and be infecting people. If you have a virus that has symptoms that are clearly present, you have a better shot of isolating those people.
Yeah, and that's I think the big challenge with coronavirus is that there's so many unknowns right now. When we go to this next slide, I just want to point out, this is another website, the Conversation. They had some really good slides also, but I found this one and I thought, history of notable pandemics. This is a little easier maybe to read, but look at the dates and look at, obviously Black Death lasted a long time, but as you go through, you start to see where I come up with this 500 to 800 day time frame, because each of these pandemics that we see have hit roughly in that kind of a time frame. Some of them have gone longer, some of them have not, but essentially we're really looking at a long-term issue that most people find it hard to, I think, comprehend in a lot of respects. So let me talk about some planning initiatives, and I'm going to focus on where we are, and then because there's a lot of recovery discussion going on, and there's a lot of looking at easing some of the restrictions we have. Although I know just today, the governor of Illinois has extended the stay home order till the 30th of May. Other states are beginning to do some reopenings, and it'll be interesting to watch how that goes, because these are some factors I look at. One is, what's the depth of disruption? And if you take business sectors like the hospitality sector, like the medical sector, like the transportation sector, like the energy industry, et cetera, you begin to define these, and you start to look at these sectors, and you start to realize what's the depth of disruption they've had, and then how fast can they come back from that disruption. So let's take, just as an example, airlines. Everybody thinks, okay, well, just, bring all the crews back and we'll start flying. But the reality is that it takes a lot more than just having crews available and planes available to be flying. So we've seen a lot of disruption in that area. The biggest, I think, other than the fact there's a little bit of an oil war going on between Saudi Arabia and Russia, was the disruption in the energy industry of crude oil prices, which actually dropped to negative pricing for a day. And that is, in a large factor of it, is due to the simple fact that there's no demand. If you're not driving, if you're not flying, if you're not using energy, the consumption demand is not there. So those sector analyses are something I would pay close attention to. How long it's going to last? I think we got two aspects to look at. One is the medical, purely medical. How long before the virus gets to a point where it either burns itself out or we develop this, quote, herd immunity? I'm predicting that this is, a 500 to 800 day event, so I'm expecting it to go well into 2021. From an economic standpoint, we've already started to see the transition of disruption there, and the duration of economic disruption, I think, will extend way beyond making potentially the financial crisis that we had look like a bump in the road if we don't manage this correctly. Then we have to look at the effect. What's the short-term effects, what's the intermediate, and what's the long-term effects? Three aspects, I think, that are really key. What are we going to do in the short term? How do we deal with the kind of transition periods? And then long term, how do we begin to start to readdress society? And then how will we look at recovery? And I'll go through the recovery aspect in a bit here. But is it going to be a rapid, a slow and steep, or undulating and chaotic? There's four options there. Can we get back to where we were before very quickly in a rapid fashion? Probably not. Slow, we'll talk about that. What I determine as steep, I'll explain it with another slide. But essentially, if you look at a pandemic, and this is where I think from a business standpoint, people who are in business have to understand it is about it is about medical issues, it is about health and welfare, but it's also about keeping your business going. So when we look at this, back in the days when we looked at bird flu and swine flu and Ebola and a bunch of other things, we started to really look at demand for your product or service. So is your product service in demand? And then you have to factor that against workload. Do I have a staff, my employees who are 100% healthy? Or is that staff less than 100% healthy with high demand? How do I deal with and address those issues? So this is a bit of a confusing slide, but it tried to depict that if you have high staff degradation, where you've got not a lot of workforce and high demand, you've got some factors to deal with. If you have no demand and a healthy staff, you've got another factor set to deal with of how do you stay in business and how do you continue to keep employees employed. It's a tremendously heart-wrenching thing, I think, for a lot of industries.
Right, and let me just so you take a look at one sector that's been in the news, because Georgia is attempting a somewhat broad reopening of its relaxation of its rules. Gyms and health and spas, places where people go to work out. One wonders what will the long-term impact be on that sector, the sort of exercise and the spa and gym industry, so to speak. The health clubs working out at home might become more popular than ever before, maybe.
Well, interesting point, Dave, because I go to a hot yoga studio, which is close by. Initially, there was a little skepticism about Crazy Geary and his pandemic stuff. And then suddenly the light bulb went on, and the owner of the studio, they decided that once the pandemic was declared, to shut down the studio because it was the right thing to do. And I had suggested to them, I said, look, you got a small business, you're going to be hanging on here. I don't know if you can survive from the economic standpoint. I said, have you thought about doing a virtual yoga studio? And the good news is what was very quickly, they actually set up and did a rudimentary first free session. They had over 100 people sign up for it. And since then, they've been managing on a regular weekly basis a schedule of virtual yoga sessions. Unfortunately, I haven't been able to attend any of them.
So how does that work for the hot yoga? You sort of get in your shower and get it steamed up. And
I think that's the yoga may be the biggest factor, but the hot yoga may be that people turn up the heat in your house or something like that. But,
sorry for the digression. Please continue.
No, but as it is, you look at my time frame here, and you start looking at how do we deal with this, and as we go longer and longer into the time frame, things are going to change. So the problems we deal with are not necessarily locked in when we start, and it's the same problem at the end. So we really need to understand this is an unbelievably dynamic situation, and it's also a situation where when we look at how we're moving forward, we have to realize whatever plans that were developed and whatever response modes we're in have begun to to change dramatically, and you have to begin to start looking at, well, here's what we had. How many of us had planned, and I know a lot of clients that had never really truly thought about the depth of working at home. And suddenly you have stay-at-home orders, you have social distancing orders that change the planning paradigm. So how do I implement a crisis plan, a business continuity plan, when suddenly my employees are not there? They're dispersed in a wide area. So we really get into this kind of, what are you doing? Seat of the pants or forward thinking? A lot of organizations hopefully are moving towards this forward thinking of what's the situation, what do I have to do to adapt the situation, and then what I call two things: active analysis, which is kind of constantly analyzing information and putting together a mosaic, a picture of where we are and what's going forward. And that takes a lot of going to places where you find good information. So I found, LinkedIn, there's a lot of good information there. Some of the news media outlets, believe it or not, Al Jazeera, I found to be a really good platform and very non-biased in their approach. There are some other ones that you can look at. John Hopkins, which I've got a link that at the end of the show we'll talk about. John Hopkins puts out some good information on the actual spread, the number. Today they just said we've got about roughly 2.7 million confirmed cases, a little over 187,000 deaths, and their graphic on their site is really a nice one, because you can break down things and it shows you kind of where the hot spots are in various countries and in various cities and various locations. So I find that really kind of a nice source of information, but bringing those together and building that kind of mosaic is really where you want to go. The concept future-proofing is basically no more than having been prepared and being able to access and maintain that preparedness, if you will. I haven't bought any toilet paper since the onset of this, primarily because I'm still working through all my Y2K stuff. But the truth of the matter is, it really does help to have some forward thinking on these issues. So where we are, I think some of the biggest issues that we're going to face, how do we respond and then manage? And when we look at response and manage, it's the immediate response, it's the long-term response, and management is going to be, it's kind of like an umbrella that has to look at workforce, has to look at what I call value chain, which is your vendors, suppliers, customers, etc. The technologies aspect, fortunately we've got Zoom, which has really been a blessing in a lot of ways. And then in terms of management, they've got to be looking at what is the government doing? Today, just now, if you think about it, Governor Pritzker decides to extend the stay-at-home order till the 30th of May. Now, Indiana has said 1st of May. How's that going to work? Because the two states obviously being close together, but the concern now is in especially like Northwest Indiana and other parts of the state that are on the border of people coming from Illinois to do shopping, to do other things, because potentially more is going to be open. So are we going to spread the virus, or are we going to, has it been contained as such? It really is a very, very challenging area to work and coordinate in. Risk exposure and innovation. This gets us in, and I've got a couple of slides here that I'll go through very quick, but the slides are essentially, I take these home and you can figure out your risk exposure and begin to start to look at what you really need to start thinking about in terms of thinking and changing your perspective on risk. How do you innovate? Innovation is a major factor. A lot of organizations that I've talked to have done some really interesting things to innovate. And if you watch the news, there have been companies on the news that have done things that went from, here's our normal business, we make signs, to here's our new business, we make protective equipment for hospitals and healthcare. We need to do it now as far as the next bullet, reentry, what I call reentry, recovery, and restoration, which is we need to plan for how we're going to get back into the normal office spaces and whatnot that we're at. How do we recover those so that we can actually bring them back into full service? And then restoration. One of the big problems that has been discussed and start to get bandied around a little bit more now is the fact that office buildings that have been shut down potentially pose other health hazards and risks. So that it's not just coronavirus, it's like you're going to go back to work, who knows what you're going to be faced with, and is your building maintenance going to be able to, essentially clean the building and do a deep cleaning of that stuff. I think we're going to look at some realignment of industries. We'll look at some regulatory changes, and then I think competitive environments are going to change. Realignment, by that I'm looking. A lot of businesses were dependent heavily on China. I think that you're going to start seeing businesses becoming less dependent on China and maybe doing more internal to their own countries or finding new sources of supply. So that whole process may change dramatically in the next several months.
Right, and we could spend an entire program talking about the recovery strategy for either the airline industry or the residential real estate industry, both of which are going to have to some extent, reinvent themselves.
Yeah, I think you're going to see a huge change, and that'll have some impact with how we're going to regulate those industries in the future and what type of things we're going to be looking at. It is a truly complicated situation of magnitude I don't think that we have ever seen. So from a planning standpoint, I just look at these as factors. What's my strategy? Which the big question here is, what are we committing ourselves to? You know, back in the day with bird flu and some other things, I had clients who wanted to buy masks for all their employees. And I said, great, that's good. For how long? And they, what do you mean? And I said, we got 14,000 employees. Do you think this is going to be over in a day? And they suddenly, you know, light bulbs started to come out when I said, look, here's worst case, 800 days is going to be like 12 million masks that you're going to have to get. And of course, then, you know, people started to ask the questions about price, storage, distribution, et cetera. And, you know, you had to tell them that, but by the way, if you commit to this, the government can actually take the mask under eminent domain for the greater good of the community. So, you know, let's look at what are we really committing ourselves to, especially now. I hate to say it, but private sector businesses have to be extremely careful in these areas because of potential liability issues. You know, so you hate to kind of see it.
That's an interesting point. One of the questions that was posed, I believe, to Secretary Mutation, our Treasury Secretary, was whether businesses in states that are beginning to ease back into normal operation, if any of their customers or clients come down with COVID-19 or God forbid pass away, is there liability for those businesses? And I think the position of the administration is there ought not be, but courts might disagree.
Yeah, that's going to be one of those areas that's going to be a long, drawn-out battle. So what are you committed to? And then the concept of operation, how do we fulfill these commitments? And the challenge, I think, there is, how do I fulfill the commitments when my workforce is no longer in a consolidated area? They're dispersed, and now I've got to look at how do we communicate, how do we focus our work efforts, et cetera. Do we have the organizational structure, literally the depth of structure that we need to be able to do a long-term response to a situation like this? Management of resources is basic: human, money, and physical resources, whether they be IT and computers or buildings or however you want to look at it. Those resource management areas are going to be huge. And that paradigm right there is to take a look, how are your HR policies and procedures going to change? And then we go to core competencies, which is, you know, do we have people that we have the skills we need? And then later, the leadership thing, and this is one that I think just goes through the spectrum on, regardless of a crisis, how do we optimize the decision-making, authority, and workflow so that things can be done and not second-guessed or micromanaged? And I think those are really high-end areas that people need to really kind of concentrate on. So this is a very quick slide, and this is where I said you're going to be able to go and take this and do a very quick assessment. So one thing I found this is very useful in a dispersed environment like we have it now is send out an email to your staff and say, okay, let's look at what words describe our organization's internal threats, hazards, vulnerabilities, where are our strengths, where are our weaknesses, what are our opportunities. Have them do it in a, you know, individually, and then collectively get together on a conference call to discuss it. You'll find some very interesting things happen when people start to think about these issues, because they all look at them slightly different.
This seems very much like the sort of a standard SWOT analysis, right?
Yeah, it really is a little bit of a derivation of looking at that aspect, but with a slight change on the focus on the risks and threats. And especially now, I would say that one of the things I would tell people, don't focus only on coronavirus. You need to focus broader than that, which if you look at the oil industry, they may have hit on that issue very well. The second part of that exercise is to look at the externals. You know, what are your risks, threats, hazards, and vulnerabilities externally to your organization? You know, where are your strong relationships with government, et cetera? What kind of weaknesses does your community present? What kind of opportunities does your business have to integrate itself more? And then where are your exposures? The external issue is really a kind of a challenge, because a lot of what organizations assume is that things are going to work because they do. So telecommunications, water, trash pickup, electricity, gas, all those things that make up our infrastructure that we depend on, you suddenly start to realize the lack of control you have over any of it. And, so as a business, you find out how limited your control is and how quickly things can happen that can take those services away. Government has a lot of national security issues, so they can actually interdict a lot of the critical infrastructure that we depend on for national security. So two quick little exercises you can do. I think some other things, and these are kind of impact challenges that you can focus in on with those two exercises. Immediate challenge, as I said, workforce. How do I keep my workforce together and communicate with them? What I call value chain, which is my suppliers, my customers, all those sundry elements that feed into some way, shape, or form touching my business. And then our operations and technologies. Near-term cash management challenges, I think that's going to be and we see it already with the hospitality and restaurant industry, managing cash. And we're also seeing it, obviously, on the individual basis for people who've been laid off from work. How do we manage our cash? Developing recovery and restoration annexes to contingency plans. I think most organizations do have some concept of those two annexes, but they really never flesh them out. And I tell you, it has been my experience over 30 years doing this, that I've only done one recovery and restoration exercise. Because every exercise we go to validate plans has always been to respond to an event. No one ever has taken the time, other than one company I worked with, that said, well, okay, that's over with, now what? How do we recover from this? What are the business impacts? How do we have to look at reshaping our business? Again, innovation, big factor. How do we reinvent the business? And then what do we need to focus on in terms of what I call discontinuities? The things that we just didn't anticipate. And one of the biggest discontinuities I have seen thus far, and as I said, we're 40 days into this roughly, is how fast we went through the personal protective equipment in the healthcare industry. I was sort of flabbergasted that they ran through that amount of PPE that quickly, and that we're kind of got to a desperation stage. But that's not just the U.S. It was Italy. It was other countries that had the same kind of situations that we've had, and it's been having to deal with those situations that have really, I think, pushed the innovation process. Prepare for shifts in regulatory and competitive environments. Yeah, I think we're going to see at the once this is over, I think we're going to see some regulatory change that will change sort of the face of industries in a lot of ways. 3 levels in terms of impact. Obviously, you got the private sector. What do we do as a business? How do we scale our operations? What do we do about bringing the workforce back? And then where are our tipping points? But that's impacted by state and local governments. The governor today decides that he's going to extend the stay-at-home order. I think there's a lot of anticipation. Everybody was looking at May 1st, or things coming back and starting to get back in. The fact is that I think he made a wise decision. I've watched the numbers in Illinois, and they've had some pretty big increases over the past few days, which would make it sensible to say, let's take a little bit more of a precautionary focus to this.
It's also instructive, I think, to consider at this juncture with this slide, the way in which our governmental structure in the United States kind of dictates the way in which the nation will respond. We don't have an overarching national authority, unlike China, that can simply order things to occur. We have this dispersed power among the states. sort of shared with the federal government in different areas. And, as one of the governors was pointing out, I think it may have been Governor Cuomo, typically when you have a hurricane or a regional disaster, there's a regional response. It's relatively easy matter to coordinate that. It's not nationwide. We haven't had anything in our lifetimes that has required a nationwide coordination of healthcare resources on this scale. And so that's been part of the unpreparedness, that you're talking about. We had a failure of imagination, I guess, that this could occur.
I think it's that maybe, and it's also that you see that states want to have states' rights and to be relatively independent on how they run their state. I think that at a point they may start to have to realize we need to do this cooperatively and not battle against each other, or not so much battle against each other. Maybe it's more of we need to get consistent with how we do our policies and procedures and what we do so we can coordinate more effectively. And it may be a regional basis where they do that, but it's got to be a situation where there begins to get more and more coordination.
Like last week, the 7 new states out of the Northeast all together decided to extend to May 15th. I was like, well, that's great. Collaboration. And they know that these residents might flock to these different states. So I thought that was just a testament of some kind of collaboration amongst states.
Even within our area here, I can remember going a few years back to a conference that was held, was like an 8-state conference that brought together all the emergency management agencies, and was focused on an earthquake on the New Madrid Fault, which would be devastating. So they literally got these 8 states together and said, well, how can we coordinate? What do we have to look at doing from a planning standpoint? Which I thought was a really good incentive, because there was a lot of discussion and there was a lot of back and forth over, well, what can your state provide and how can my state help you, and what kind of things are we going to find that are going to be nice thoughts, but unfortunately we can't do. So it really brings together a lot of open-ended discussions. I think we're in that situation now where we need that active discussion to go on. Some big, obviously, workplace safety and security, major issue. Safety and security not only for the health and welfare of employees, but also your organization's critical data, so that it's not subject to cyber threats, which are now starting to blossom very rapidly. Looking at redefining our strategy for the organization, what's our goals and objectives, and how can we be more agile to do quick shifts, financial impacts, and then what I call transparent vulnerabilities, these are like the things you don't see until they're pointed out, and then you go and have an aha moment. So when I wrote my book on pandemic planning, Charlie Carey, who was chairman of the Chicago Board of Trade, graciously did the introduction for me. And initially we had a discussion at the club, and he was kind of like, I'm not sure what I can do to, how I can help out here. Well, next thing I'd given him a paper and said, well, here, look, I've done some stuff on economic consequences. Take a look, called me up. I ended up in his office, and he basically enlightened me on some risk issues and some other things that I had not really thought about. And his point was, we're going to have a food chain disruption. And I thought, okay, because there's not going to be a lot of pit trading and you're going to have to do more electronic. He's no, is that it's a risk issue for traders. And his point was that if you have a trader on the floor and you only have, as he pointed out, 80,000 USDA inspectors, and he said, based on what you've told me, 40% of these guys are sick. He says, you're not going to get a lot of USDA stamp of approval on that side of beef, etc. And his point was that the risk for a trader to take on an uncertified product was greater than what he would feel he could do. so that it would disrupt the food chain in a lot of respects.
And by the way, just by sheer coincidence, since members of my family by marriage are involved in the agriculture industry, this issue of meat inspection is one. All the individual states have their departments of agriculture that certify and inspect meat that's processed in their respective states, but you can't sell that meat. Let's say if it's inspected and approved by the Department of Iowa Department of Agriculture, you can't ship that across state lines. There's legislation now being introduced to Congress that would allow meat products that are certified as safe by any state licensed authority, any state department of agriculture, to be sold anywhere in the country, so that USDA's role might change a little bit. But there's an example of adaptation that people were already talking about.
Yeah, actually talked to a client in Missouri last night, and they were saying that they have started to notice there is a chicken shortage. And I thought, well, that's interesting. And then the same kind of situation where they're restricted to what they have in their state, and so there's not a lot of cross channeling on things. But the point is that these are really things that are going to have to be addressed and really worked out in the future. A future state of work. Well, everybody likes to talk about new normals and all these other things. I look at it in this respect. Are we going to find that we can run efficiently with more dispersion than what we're used to? And will we start to see a switch over from the traditional shopping habits that we have to now a new shopping habit? Will air traffic change? Will rail traffic? All these things I think are going to be it needed to be addressed and needed to be studied. And best time to do it is now, when we start looking at what's going on. So the whole aspect of what I look at here was returning to work, and is that who, the 5 questions: who, what, when, where, how. Who are the key people? How are we going to look at flexibility, virtual environments, and what I call ancillary staff? When, what's the first 30 days going to look like? 30 days to 60 days, then beyond 90 days, how are we going to look at these things? And how fast can we transition in and out of those periods if something happens like a second wave? How do we do it? Obviously there's going to be some governmental coordination has to go on. There's going to be some defined restrictions. I'm very certain that government's going to step in and look at putting restrictions in place. Wearing masks, for instance, on-site alternative locations, remote locations, mobile. And a lot of people in disaster recovery and in the industry that deal with crisis always look at, well, we got an alternate work site. The fact is, how are we going to look at how we can begin to do business at those facilities, and how can we coordinate a lot of this? And then the what, which is real simple. What's my product? What's my service that I'm offering, and who wants to buy it? And what do I have to do to realign so I can get, customers to buy my product and service? So a big challenge in a lot of respects there. How do we protect employees? Considerations here as far as what I consider kind of strategic. Obviously, people is the biggest one. Do we do cross-functional teaming? Reskilling employees so that they're not buttonholed into a situation. Again, this is where I had a healthcare organization that does insurance, and they had group plans and they had individual plans. And the reality, when we did a large exercise, was that the group plan people said, we don't have a lot to do because you're telling me everything's getting shut down. And the individual plans people were saying, we're going to be overloaded. So they really quick recognized that, hey, we need to do some cross training. Contingency plans, roadmaps, validation, assuring liquidity. I think this is a big challenge. How do you make sure you've got enough cash to continue the operation? Stabilizing your value chain, staying close to what I call stakeholders, broad area, and how do I do it, especially today with social media, and then validating your plan. Literally, it's not a bad time to drill an exercise at this point, because thorough in-depth simulations can help you, and you've got plenty of stuff that you can draw on a daily basis to look at. What do we do? What do we do? And then I continue to stress innovation of operations, services, and then your strategic focus. The things that I think most organizations have a big challenge with in this area is the top probably three of these bullets. One is a succession directive or protocol. Succession planning is one of the areas that small business, medium-sized business finds it really, really hard to do. Global organizations also find it hard to do. And some of the non-government organizations I work with found succession planning to be a real challenge in a lot of respects. But you need to have some sort of a succession plan. Instead of developing a policy and protocol for coronavirus, develop a policy and protocol for communicable diseases. You've got, the spectrum that's out there of communicable diseases. Don't lock yourselves in, because you might find yourself with a liability that you need to overcome, legal liability as well as individual liability as far as things go. Create a task force. Pandemic task force is probably one of the valuable areas, but the fact is, and I'll go into it when we talk about organization, it's a big challenge to get a task force to work. And then what I call perforating silos of excellence, which essentially is breaking down all of the barriers between the normal departmental things that we face. Legal doesn't want to talk to HR doesn't want to talk to operations, et cetera, et cetera. So breaking that down, getting them to talk to each other. And again, my focus on innovative strategies, building some things. As far as recovery goes, I'll give you what I consider to be three potential scenarios. Are we going to see a rapid recovery and a return to normalcy? Kind of like a steep V. We went down and now we're going straight back up. I don't think so. My personal opinion, I would be very surprised, because I don't know how we would sustain the recovery on that basis. A slow recovery, and unfortunately I couldn't get the U to get any wider than a normal U, but a slow, wide, if you think of a U and stretch it out so that it's got a lot of reconfigurations and a lot of just a slow process. And then you have what I call the undulating one, which is go and look at a seismograph and see what an earthquake looks like with a lot of ups and downs. I would venture to guess that there's going to be a lot of starts and stops and a lot of confusion and chaos in many areas as far as
Geary,
recovery.
Let me just break in for a second, just to remind everyone who's in our audience, if you have any questions, please type them in the chat box. I think you've been so encyclopedic with your coverage of this subject matter that everyone's just sort of been taking it all in. But I have a question for you. Okay. Looking very broadly at the economy, and particularly smaller businesses, what kind of hit do you think the market is going to impose as a result of this crisis? How many small businesses, as a percentage of the totality of the small business world, are we likely to see go away and not come back? Are we looking at a 20% kill rate, so to speak, to use an unfortunate term? 30% might not make it back. What do you think?
I would venture to say that you could see upwards of 20 to 25%, because businesses, and mind you that would not be solely due to the pandemic situation. A lot of businesses don't last very long regardless. But I would say that you could see some substantial impact unless, in this regard, unless the government steps in and really does something to assist those businesses. Now, that being said, that's going to take some real looking at what your business is. I mean, obviously, if your business was not a great business to start off with, you're probably not going to be able to make it through this process. And it's going to be all on, a lot of it's going to be on demand. Was your business, did you have a lot of demand for what you were doing? or were you producing stuff that nobody wanted? So yeah, I could see it have a substantial impact. And I think the area is obviously, the airline industry, big shakeout, I think, potentially there. The energy industry, we're already seeing a lot of shakeout in that area with potential bankruptcy issues. The shipping industry, which is waterborne ships and then airborne shipping and then also ground transportation, I think they're sort of on tenterhooks right now on a lot of issues because of human capital issues.
Is it too broad a statement to say that we're going to see a global realignment of industry and businesses just everywhere? I mean, because this is, as I say, the global pandemic, presumably there'll be a global business fallout.
Yeah, I would say that that's an accurate statement. I think you're going to see it, and not just look, from the U.S. standpoint, but look at businesses all over the world and start to realize how dependent those businesses are in terms of cross-border traffic and in terms of, the workforce displacement that they're going to be faced with. So skilled workforce is going to be a huge factor in a number of ways to have to deal with a workforce that may not have the capabilities that you need. So I think it's going to be a big, long recovery from an economic standpoint.
Okay. Well, Gary, as we're getting toward the end of our webinar, but I wanted to be sure you had an opportunity to go through other slides you may have in the presentation, and to maybe we could, sort of give a little summary at the end, but you have further info to share with us. I don't want to.
Yeah, no, I've got a few more that I'll kind of run through very quickly, just because I think they're worth mentioning and talking about. Look at healthcare recovery. I look at one scenario, a lot of variable, viral mutation. There's 30 strains right now. Will we get a vaccine and treatment? How much, how long, and what's it going to take? My big concern area in terms of healthcare right now is Africa and South America, because they have yet to actually have the big kind of surge that we started to see. And then with healthcare reorganization, there's a huge infrastructure that has to be reorganized, and the talent pool there has got to be addressed in some way, shape, or form. Three types of organizations that I look at in terms of the ones that are going to make it, the ones that won't. So you got type 1, which is what I call the resilient one, which has embraced risk management and is doing a lot of processing based on decision making that looks at factoring in a lot of risk issues. The second one is kind of dependent on luck. Yeah, we do risk management just to meet regulatory requirements, but we haven't really thought about it. And then the third type of organization, which is kind of, as someone said, well, I'm blissfully naive about this. The fact is that if you're blissfully naive, you're probably not going to be around from a business standpoint, and who knows, from a health standpoint, as we go through. So those factors are there.
Well, we have a question that is great and is certainly is far from naive, and a very good question. One of our audience members asks, can you tell us how can your firm assist a firm that is involved in this crisis or in response?
I would say that one of the things that we do that would assist organizations right now is to begin to help them organize and have a plan in place, or look at plans and start to help them reevaluate and restructure their plans, reassess policies and procedures, begin to start to look at how they can actually make their workforce more flexible. As far as, helping them innovate, if you're in manufacturing, there's a lot that can be done, but you have to, almost with a manufacturer, you have to look at what they have hardware-wise that can be transitioned to a different type of use. So yeah, it's something that can be done, and it's something that I would look at, and just doing tabletop exercises, getting people to put their heads together and say, here's where we're at, what do we got to do?
And I
Let me,
suppose if somebody's interested in more information, it's Logical Management Systems that can be found online. You have a web address for us for
yeah,
this one?
actually on the last couple of slides, let me just really
Okay,
quick,
please.
the three tiers here of staffing I'll go through: strategic, operational, and tactical. And then what I break it down is to executive management, administration, operations, and what I'll call emergency and incident response. All three have some aspect of dealing with each other. So you have to work up and work down from a process. Defining, and this is, I think, really critical, who are your essential staff, the key decision makers? Who are the critical staff? Where are we getting the technical skills? The support staff, and then what I call ancillary staff, which doesn't mean that they're not useful or they're not really knowledgeable. They're just the people that you want to put on call to make sure that they can be available if something happens. And they're probably as involved as these other staff members on a regular basis. So it's just a breakdown that makes it easier. As far as functionality, this is kind of a standard. What we look at is 8 key functions. What's our leadership and management? You know, who's the decision makers? How do we deal with that? Short and long-term planning, operations, what's affected, what's not affected, how do we prevent a cascade effect, how do we manage our logistics, our finance, administration, HR policies, procedures, infrastructure, internal and external infrastructure. What do we control? What don't we control? And then internal and external relations. This whole aspect of, you know, social media and whatnot, this is a really big area that has become very critical to a lot of organizations. So those factors, I think, are really key in a lot of areas. The biggest challenges I think we face here is very simple. You pull together a team, you call them a crisis management team, and you find out your biggest challenges, while they work together on a day-to-day basis, they don't function every day as a crisis management team. So getting them to comprehend their crisis roles and responsibilities versus their day-to-day roles and responsibilities gets to be a challenge. The other big challenge, and this is pandemic related, I think, as we see it, cohesion as a team working remotely. Huge challenge. So let me just go. I got a couple more slides as far as concluding comments. The website that's listed here on the summary slide is the Johns Hopkins website. So you can actually go into that website and very quickly find a very nice chunk of data that gives you worldwide coverage on, you know, number of confirmed cases, number of tests that have been done, number of deaths, and it breaks it down fairly nicely in a lot of areas. Workforce absences, travel restrictions, you know, working remotely, all these things that we've kind of discussed, I think, are big factors. Revenue chain impacts, big issue for a number of organizations, and then recovery funding issues. You know, this is an area where you may have business interruption insurance, but you may find out that you don't have the right writers. It's a big issue now. I know there's a lot of discussion in the insurance industry right now about whether or not this is a coverable. So it's a challenge area. Prolonged challenges of staff absences and remote working. How do we get them back as, you know, a workforce? Infrastructure lockdowns. This is an area that's interesting. We have not had a lot of disruption in infrastructure to date. But as things go on and as more people potentially get ill, you could see some real challenges for infrastructure. Information and cybersecurity threats huge because there's all kinds of scams out there, you know, in this area, and there's all kinds of threats to the business. Security threats, physical security threats. Your premises is unoccupied because it's shut down. Who's to say that it's going to be secure? You know, again, value chain disruption might look at customers and suppliers, etc. Potential for utilities failures. I think it's out there. We haven't had it yet. Fortunately, we've been lucky. But you know, all it takes is one bad natural disaster, and suddenly you have no utilities. And then again, my stress on information and innovation. The things to consider. We got a lot of long-term things to look at: medical problems, business problems, municipal problems, shortages. We haven't seen it quite yet, but we're starting to see it a little bit. Social unrest and riots. There's been kind of an uptick in protests. You know, we want to go back, pull this stay-at-home stuff. We're tired of it. We're finding how patient society is, and I find that society is not too patient. Transportation disruptions, yeah, and a lack of liquidity. I would say that's a big factor for a number of organizations. So I'll close it out here with a nice picture of my book. A fortunate thing that I was unaware of, but a doctor who I know actually made a wonderful comment that I had not seen, but he said that it's the only book I've ever read that gives a comprehensive approach. And then you've got all of my information. I would say best hit me on my AT&T as far as email, and then the phone number right there. But yeah, it's not going to be an easy process for us to go through. So,
well, Gary, I can't thank you enough that we have a couple of other people who weighed in with some late questions that
sure.
we don't really, unfortunately, be able to get to those. But I want to mention for everyone who has joined us tonight that the recording and all of the slides that you've seen during this presentation will be available in a recording that we will provide to everyone who registered and participated, and there will be a link provided as well coming up shortly at the Union League Club's website for folks to click on and to view this presentation. And of course, to get information of how to get in touch with Gary Sikich. Marco, thank you for helping to pull this together, the Health and Life Sciences Subcommittee. We want to thank Gary Sikich of Logical Management Systems for joining us. Keep doing your good work. We appreciate it. We've got a lot of great information tonight. The most important of which is have a plan.
Yeah, and wash your hands.
So Gary and Marco and ladies and gentlemen, thank you for joining us. Another presentation by the Union League Club's Public Affairs Committee. We hope that you all stay safe and well, and we look forward to seeing you at our next event. Have a good evening, everyone.
Thank you, Dave. Thank you, Gary. Thank you, everyone.